Ketamine is used as an anesthetic drug since 1960s. In 2019, a form of ketamine called S-ketamine was approved by FDA to be used as an antidepressant. Now, how does ketamine help in depression? Ketamine binds to NMDA receptors in the brain that produces glutamate. Glutamate is an excitatory neurotransmitter that helps in mood regulation, improving the cognitive thought patterns. Ketamine also stimulates the production of BDNF, that is brain-derived neurotrophic factor, that helps in neuroplasticity, which helps the brain to adapt to new positive thought patterns and change the old negative ones, which is common in depression. Ketamine is generally administered by intravenous route. However, it can also be given orally by intramuscular route, subcutaneously, or intranasal sprays. Now, what is the basic procedure of ketamine infusion? Ketamine is generally done in OPD basis, in which the patient is kept nil by mouth for 3 to 4 hours before the procedure. Before starting the procedure, the vitals of the patient like blood pressure, heart rate, oxygen saturation are checked and monitored throughout. Supportive medications are given to prevent side effects, and ketamine dose is calculated according to the body weight. The calculated ketamine dose is given for 60 minutes via an infusion pump. Within few minutes after starting the infusion, some patients can feel floating sensation or feeling disconnected from the body, which is very normal after having ketamine injection. This is the dissociative experience. Most common side effects after ketamine infusion are headache, dizziness, vertigo, nausea, imbalance, hallucinations, and dissociative experience. Ketamine is generally started with 2 infusions per week, then reduced to 1 infusion per week, and eventually to 1 infusion every 2 weeks to 4 weeks. Ketamine can also be used in patients suffering from anxiety disorders, obsessive-compulsive disorders, post-traumatic stress disorder, and bipolar mood disorder without psychosis. Ketamine infusion therapy is contraindicated in patients with severe cardiovascular diseases and having a history of angina or stroke, patients with chronic liver disease, pregnancy, psychiatric illness involving psychosis or delirium, and patients with alcohol or any drug abuse. Advantages of ketamine infusion therapy are: it has rapid onset of action, it works on different brain pathways contrary to other antidepressants, and it can be used in treatment-resistant depression where trials of 2 antidepressants have failed for the patient.